Now the last two types of allergic conjunctivitis, they are atopic keratoconjunctivitis and pilectinular keratoconjunctivitis. Atopic keratoconjunctivitis, it is the bilateral chronic allergic inflammation of the conjunctiva, mostly associated with atopic dermatitis. Okay, so bilateral allergic inflammation mostly associated with atopic dermatitis. It is also a type 1 hypersensitivity reaction, okay, like acute allergic and seasonal and perennial allergic conjunctivitis. The clinical features of AKC, atopic keratoconjunctivitis, they are more like VKC, vernal keratoconjunctivitis. So most of the clinical features, they are similar to vernal keratoconjunctivitis. For example, bilateral red eyes with watery discharge. Most patients are young adult males and most of the patients have asthma, okay, with the exception of few. So the differentiating point which differentiate atopic keratoconjunctivitis from vernal keratoconjunctivitis, they are, when we look through the conjunctiva in atopic keratoconjunctivitis, there will be micropapillae on the tarsal conjunctiva and inferior fornical conjunctiva, okay. The next one is, as we noted, in the vernal keratoconjunctivitis, the conjunctiva is red. The conjunctiva is red. But in atopic keratoconjunctivitis, it will be pale. So micropapillae, conjunctiva is pale. In the corneal and conjunctival complications, there is more chance of corneal and conjunctival complication. For example, corneal scarring, corneal opacities, conjunctival scarring, and entropion, trichiasis, etc. So these complications, the corneal and the conjunctival complication, the chance of these complications are more in atopic keratoconjunctivitis, okay, than with vernal keratoconjunctivitis. So in atopic keratoconjunctivitis, we will have micropapillae, pale conjunctiva, corneal and conjunctival complications. And the treatment is similar to vernal keratoconjunctivitis, such as cool compression, antihistamine, mast cell stabilizer, combination of mast cell stabilizer and antihistamine, NSAID, steroids, immunosuppressants like cyclosporine, methotrexate, etc. So the treatment and most of the clinical features are similar to vernal keratoconjunctivitis, with the exception of these features which differentiate atopic keratoconjunctivitis from vernal keratoconjunctivitis, okay. Now the last of allergic type of conjunctivitis, it is pilectinular keratoconjunctivitis. It is the allergic inflammation, it is a localized nodular allergic inflammation of the conjunctiva, in which there will be the formation of nodule, okay. So there will be the formation of nodule on the bulbar conjunctiva. So it is a localized nodular allergic inflammation of the conjunctiva. Etiology is that it is type 4 hypersensitivity reaction to microbial proteins. For example, now we know that the most common cause of the pilectinular keratoconjunctivitis, it is the staphylococcal proteins, staphylococcal aureus bacteria proteins. But previously it was thought that the proteins which initiate the pilectinular keratoconjunctivitis, it is tuberculoprotein. But now we know that it is actually the staphylococcal protein which is responsible for pilectinulosis. Okay. Other microbial proteins such as other parasitic protein, fungal protein can also initiate this type of nodule. What is the pathogenesis? The pathogenesis is that it is type 4 hypersensitivity reaction. So when a microbe comes, okay, it will be encountered by T cell. The T cell will go and it will activate the immune system and will produce antibodies. So the production of antibodies and the activation of immune system will cause the infiltration, okay. It will cause the infiltration under the epithelium of conjunctiva. We know that under the epithelium we have the stroma layer, and in the stroma we have different types of inflammatory cells, nerves, blood vessel, etc. So under the conjunctival epithelium, because of this activation, an infiltrate will accumulate, and this subconjunctival infiltration will cause a small localized nodular elevation, which is called pilectinol, okay, pilectinol, and the process is called pilectinidosis, okay. So there will be the formation of subconjunctival collection of lymphocyte which will cause pilectinol, and this process is occurring basically on the bulbar conjunctiva near the cornea, okay. So near the cornea on the bulbar conjunctiva we will have a small nodular elevation which is called pilectinol, and the process is called pilectinidosis, okay. So this was the pathogenesis. The clinical features can be classified like the we can see that it is keratoconjunctivitis, so it can cause keratitis and conjunctivitis, okay. So the pilectinular conjunctivitis, these features will be the redness of eye, watery discharge, and there will be a localized nodule on the bulbar conjunctiva near the cornea, okay. This nodule is called pilectinol, and this pilectinol is basically the collection of lymphocytes under the epithelium, conjunctival epithelium, okay. This will be on the bulbar conjunctiva near the cornea, okay, near the cornea. So these are the features of pilectinular conjunctivitis. Pilectinular keratitis is that there will be the corneal features and keratitis. There will be punctate epithelial erosion, micro erosion, macro erosion, ulcers, etc. Okay, so there will be keratopathies and pilectinular keratitis. And in pilectinular keratoconjunctivitis, both features will be present. The redness of eye, watery discharge, pilectinol, keratopathies, etc. All both features will be present in this pilectinular keratoconjunctivitis. Okay. So the treatment options for the pilectinular keratoconjunctivitis, they are steroids, because this is the inflammation. If we control the inflammation, it will resolve. It will resolve the condition. And as we are using steroids, so there is the chance of the secondary bacterial infections. We will also give the patient antibiotics. Okay. Remember one more thing in the pilectinular conjunctivitis, that it passes through several stages. First of all, its course is about up to by 10 days. So it is a 10-day course, 10 days course, in which there is, first of all, there is infiltration. Infiltration will cause what? Infiltration will cause elevation, and this elevation will then, this pilectinol, this nodular elevation then will rupture and will resolve. Okay. So these are the stages through which this pilectinol, a nodule passes. Okay, in resolution. And remember this, although it is an inflammation and it is elevating and it's rupturing, but it does not cause significant scarring. Okay, it resolves without any visible scarring. So, and it follows a 10 days, approximately 10 days course, pilectinular keratoconjunctivitis. Okay. So we have covered all the types of bacterial conjunctivitis, viral conjunctivitis, and allergic type of conjunctivitis. I also have prepared notes. I will give the link in the description. You can also go through the notes and can have more understanding of the topics. Okay. Thank you for watching the video.